Greetings. Today, we continue part 2 of our peptide series, exploring TB-500 and its potential benefits. Peptides are short chains of amino acids made by our bodies that act as powerful signaling molecules. Like hormones, peptides deliver messages to cells to trigger actions. Compared to hormones, peptides are much more specific in their instructions to cells. They perform all kinds of functions, such as triggering repair, regeneration, metabolic balance, activation of specific functions, and performance optimization. Because of their precision, peptides are becoming increasingly popular in longevity, regenerative medicine, and performance-focused health protocols. I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired a great deal of specialized health-related knowledge that he wants to share, hence his videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now let's get back to today's topic, but before that I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Thymosin Beta-4, commonly referred to as TB-500, is a naturally occurring peptide that plays a vital role in tissue repair, cell migration, and inflammation regulation. It has gained significant attention in regenerative medicine, sports recovery, and peptide therapy research due to its ability to support healing across multiple tissue types. Unlike therapies that target a single pathway, TB-500 works at the cellular level to assist the body's natural repair mechanisms, making it a widely discussed peptide for injury recovery and tissue regeneration. Thymosin Beta-4 is a 43 amino acid peptide found naturally in high concentrations throughout the body, especially in areas of tissue injury. It is involved in the regulation of actin, a protein critical for cell movement and structural integrity. TB-500 is a synthetic version used in research settings to study its effects on healing, inflammation control, and cellular communication. TB-500 supports healing by promoting cell migration, allowing repair cells to move efficiently to injured areas. It also helps regulate inflammation, ensuring that the healing process is effective without excessive tissue damage. Another key mechanism of TB-500 is its role in angiogenesis, the formation of new blood vessels. Improved blood flow enhances oxygen and nutrient delivery to damaged tissues, accelerating recovery and tissue repair. One of the most common areas of interest for TB-500 is muscle repair and recovery. Research models suggest it may help support muscle fiber regeneration following strain or injury. By reducing inflammation and encouraging new tissue formation, TB-500 is often discussed in sports recovery and performance optimization contexts, particularly for individuals dealing with repetitive muscle stress. TB-500 has also been studied for its potential role in connective tissue healing, including tendons, ligaments, and joints. These tissues typically have a limited blood supply, making recovery slow. Through angiogenesis and cellular repair signaling, TB-500 may help improve tissue resilience and mobility while supporting long-term structural integrity. Inflammation is a natural part of healing, but prolonged inflammation can impair recovery. TB-500 helps modulate inflammatory responses, allowing tissue repair to progress more efficiently. Additionally, TB-500 has been studied for its immune-regulating properties, supporting balanced immune activity without suppressing essential defense mechanisms. Research has also explored TB-500's role in cardiovascular and endothelial tissue repair. Its ability to support blood vessel health and cellular regeneration has made it a subject of interest in cardiac recovery studies. These findings further highlight the peptide's systemic healing potential beyond musculoskeletal tissue. Emerging research suggests TB-500 may support nerve regeneration and cellular protection following injury. By reducing oxidative stress and supporting cell survival pathways, it may contribute to improved nerve signaling and recovery. This area of study continues to expand as researchers explore the peptide's effects on complex tissue systems. TB-500 is classified as a research peptide and is not approved as a prescription medication. Most available data comes from laboratory and animal studies, with lots of anecdotal data, but limited human clinical trials. As with all peptides, TB-500 should be discussed within an educational and research context and considered only under the guidance of qualified healthcare professionals familiar with peptide science. TB-500 stands out due to its broad regenerative effects, supporting muscle repair, connective tissue healing, inflammation balance, and vascular health. Its ability to work across multiple tissue types makes it a foundational topic in regenerative medicine and peptide therapy education. Thymosin Beta-4, TB-500, represents a powerful area of peptide research focused on cellular repair, tissue regeneration, and recovery optimization. Its role in cell migration, angiogenesis, and inflammation control continues to drive interest in both clinical research and educational discussions. TB-500 is best combined with BPC-157 as they have synergistic effects in terms of the healing processes they stimulate and support. As science advances, TB-500 may play an increasingly important role in future regenerative and recovery-focused health strategies. In the meantime, we are actively using it as part of our Wolverine Healing Protocol at the Age Reversal Technology Center in Sarasota, Florida.